on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.
Hi, Baton Rouge, District 10. And I should say all of Baton Rouge, because I want to welcome you to the Coleman Cares podcast, where we hope to educate and empower the people. With that being said, this day I have with me, and everybody ought to stay tuned because some important information will be coming near you. I have the one and only Dr. Sharolyn Vincent Arrington. And you see that DNP there? That's Doctor of Nursing Practice. And that FNPC, Family Nurse Practitioner certification. Yeah, that's a mouthful, and it's a lot going on here at the Leo S. Butler Center. Want you to know that Dr. Arrington is here today to share with you some great health information. So, Doc, take it away. Let everybody know who you are and what you're doing here at this Leo S. Butler Center. You're not exercising here. You're not doing the Metro Health here. You're not doing all of the other, the Council on Aging here. But you're doing that medical component that's located here in the Leo S. Butler Center.
Well, first I'd like to say thank you, Ms. Coleman, for the opportunity to come in here and provide health care, not just to District 10, but to the entire city of Baton Rouge. So first I'd like to say thank you to that piece.
Thank you, thank you.
And it has been so rewarding for me because I've gotten the opportunity not to just care for patients or people within this area, but in the surrounding areas. And not all the patients are indigent or without insurance. We have quite a few patients that does have insurance, but want to receive good health care. And that they have the opportunity to learn more about themselves than they've ever learned before without being fearful or scared to get whatever information that they need to get in reference to themselves.
Yes.
And so it has been exciting. Currently we have a large population of patients by just not by referrals, but by word of mouth. And so they've got to see healthcare within a full circle. There within this clinic, not only do I write prescriptions, but I also educate. I also provide patients with the assistance and resources that they need for those expensive meds, such as diabetic medications that everyone's talking about, the Mounjaros, the Ozempics, because not every insurance covers that, but there are resources that are there. Or the simple medications like hypertension medications that some people live on fixed incomes, that there are resources out there that can help them maintain their blood pressure. Some patients just require simple education related to their illnesses or their chronic conditions that they've never received before. So I put it in terms where they can understand it, that they can return back. Sometimes they actually just need a simple touch to say, hey, it's gonna be okay, or that this too shall blow over. Sometimes they'll come in there related to employment issues that we talk about that can also turn over to concerns related to their hypertension that was once controlled with just diet, but now may require some meds in order to do that. One of the biggest issues that you're seeing now is mental health and simple things like anxiety that can be related either to work or domestic. And most of the time, especially people of color, it's a stigma that you should be able to sometimes pray it away or fasted away.
Yes.
But all
Yes.
the while you're doing that, you're still going through. And you just need something to be able to go to the next day. And that you have a lot of single mothers and some dads that's out there struggling with work and kids and schooling. And so it's important that these type of clinics become more involved into community centers, because that is where there's help.
And saying that, you're from this South Baton Rouge area. Yes.
I am. So I'm born and raised here in South Baton Rouge, 10 steps from McKinley High School. My mother and father, my mother grew up on Taft. My dad grew up right there on Georgia Street. And so he was known as the newspaper man. And so watching him as a kid going back and forth to the physician's office and actually passing away at home, that is what changed my vision as to the need of putting these type of clinics and healthcare where it was accessible for working parents, people who live on fixed incomes, by just watching it right there in my home. So being born and raised down here was a pleasure. My bulk of my career came from Our Lady of the Lake, where I worked there over 30 years, transitioned out of there, went into private practice. But I always said, and you know, anyone who knows me would say, I'd pass this center most of the time, and I get tearful behind it because I could see the light shining at night. And I'd say, you know, I really want to come back home and make a difference. And so and that's what I've done.
You've truly done that. And as a matter of fact, when you talk about wanting to come back home, and I remember when we first started the conversation, your passion for this community and wanting to serve the community, that and the impact that you've made, and talking about the accessibility of the services. And so, you know, we talk about Medicaid, Medicare, wellness examination. Talk to us about that. We want to educate the communities about all of this.
Yes, and so when I start to talk about that, okay, everybody hears the big, beautiful bill. The big, beautiful bill. What does that mean? You also hear about millions of people who are currently covered. What's going to happen? Because they keep saying a lot of people are going to have their insurances cut. So when we look at this, it's strategic, okay? When open enrollment occurs, you're going to get some information. You're going to get it in your mailbox. If you're one of the ones who gets your mail, put it on the counter, go about your business, and the only mail that you look at is your light bill, your water bill, maybe your sewage, but all the other mail, you just put it aside, whether that's Medicare, whether that's Medicaid, or maybe those added insurances that you may opt to not have related to Medicare, and you put it aside. And guess what? When you happen to open it, it says you have between 24 to 72 hours to complete and send back. But when you look at the date, you're 4 days past. You've lost your insurance. You pick up the phone and you call, and they'll tell you, sorry, you've missed the deadline. You have no insurance. And so now you're stuck because you have to wait a whole nother cycle between the months of October and November the following year. So you're going the entire time without insurance. That's the same for Medicaid. Then they're saying, okay, in order to receive Medicaid, you now have to work 20 hours. But then you may be $20 over of the allotted amount to receive it. So now you've lost it. So that is how people are going to start to lose their insurance. It's sad, but it's true. And so you have to find providers like myself who's well versed and say, okay, bring me your paperwork. Let's look at it. Let's appeal it. Okay? And then I, in turn, teach you how to do that. We get on the phone, we start appealing, we start asking, what are the next steps to doing that? So that is how millions are going to lose their insurance. Some people believe that Medicare Part A and B, they're free. That's not true, because that Part B, you do have to pay for it, okay? Some people may pay $50, some people may pay as much as $189 a month. So what do you choose? Your lights or the $189? So Part A for hospitalization, Part B for your doctor visits, your outpatient physical therapy, your home health. Those are the things that your Part B pays for, but if you can't afford to pay for it, you don't have it. And so all you actually have is the hospitalization part of your red, white, and blue card because you can't afford the Part B. A lot of people don't understand that. And so that's why these clinics are important, that there's someone well-versed in these areas to help, or that mother who has 4 or 5 kids, but then they don't have any type of insurance, but they don't even have a clue where to go, or they got this letter in the mail and they don't understand the wording to it. They need to be able to feel comfortable to even just walk in and say, can you help me? And sometimes it's just the simple things. Oh, that's all I need to do? Yes, that's all you have to do is do this piece. Or you take 5 minutes, pick up the phone, and help them. Because I was born and raised down here. And when I began to look back at my life down here, did they expect for me to win?
Wow.
No. Did they expect for me to win? Born down on East Grand Street, Buchanan Elementary, McKinley Middle, McKinley Senior High School. Was I expected to win? So that is my passion. That is why I came home, to tell little boys and girls that you can. Irrespective of what anyone says, the rainbow is there. All you have to do is reach. Look at me. If I can do it, you can too. And so that is why that door at First Health and Wellness in this center is never closed. Every patient that I have my cell phone number. You pick up and call me. I prefer you call me than urgent care, me than ER, because no one knows you better than yourself and me. And that if you need help, I'm going to give it to you. I'm going to pat you till you get here, but at least I know that you've gotten what you need. Because a lot of patients, when you look at it, we're number one in everything that is bad. Diabetes, hypertension, STIs. But how many providers have actually sat with the patient and explained, taught, put it in words where they can explain it? Because I believe this is, and every patient will tell you this too about me, that I say to them that I'm not in it for the money, but what I'm in it for is for you to win, because I know that if I do what is right by you, God gonna bless me coming in and coming out. And so I expect my patients to win. I educate, because the more I teach you about you, you can go anywhere. You can leave me, go to the lake, Baton Rouge General, here. And you can say, no, my WBCs don't run that. It runs this, because I teach you what they are, what they're for, what they're responsible for. Vaccines, I talk about that.
Yeah.
We talk about vaccines. We're seeing these things on the rise, that hospital pediatric facilities are full because of mumps, measles, and rubella. These strange, debilitating conditions that look like polio, but they won't call it polio. I think it's polio, because what you have to do is that these are vaccines that keep kids healthy as well as adults. And so why do we get away from it? But why? Because who's going to suffer the most? Zip code 70802, 70805. Those are the ones that suffer the most. And so it's important that we teach that these things are what's keeping us healthy. COVID is back on the rise. And so I've seen more COVID in the last month. It's scary. And so why are we getting away from it?
What are some of the symptoms of this new COVID?
And so what we're now seeing is that some patients will come in with something more like a GI, nausea, vomiting, upset stomach. And then they'll start with this extreme sore throat. Spike attempt, it goes away. And then it just gets worse, okay? That's when they start with the nausea, the vomiting. Then they start with this cough. And it almost sounds like a howling cat or dog. And then you swab, they're positive. They're telling us that, okay, this medication, Paxlovid, that really cuts the symptoms of it. Or they'll say, you can go back to work the next day. So you think about the 70-year-old who has to work with a low immune system. You're positive for COVID, so what you think you're doing? You're just passing it along. You may do well, but your 70-year-old coworker may not. Pass away. So now you've left an elderly man or woman at home with something simple as to just stay home, try to test negative, get those symptoms under control, and then go back to work. I know times are hard, but we've got to do something because it is affecting those communities that look like you and I the most.
Yes.
It really is, and so to protect you, I say if you're sick, call me. Let's get on a video. If you're sick or you're running a fever or anything of that nature, we can support that. Okay, so yes, that's what First Health and Wellness it does, Ms. We do so much here back there in the back of that clinic. Until
I know you have you do blood work.
I do.
Yes, you
and
do
so
your own.
I do. And so I draw my own blood work. What I look for, I make sure patients' kidneys are doing well, and I educate you why I'm looking at that. I look at things simple as your thyroid that sits right above your neck. I call it the oil in the motor of a car. It keeps everything regulated. So you'll always remember that if I say that to you. I look at your liver. I look at things like your A1C. And so your A1C, you hear it a lot, or your physician will say, oh, everything looks fine, but you have diabetes. Well, how do I get diabetes? Well, that's what we look at. We look at things like your hemoglobin A1C, whereas that is a snapshot of what your blood sugars run 2 hours after eating. That tells me, okay, I need to teach you stay away from the sugars. But I'm realistic about it because I know that just walking in and saying, hey, stop all sugars. I'll tell you why I need you to stop them, but then I give you an alternative like raw honey. And so when we look at things like that, we look at, God gives us things like a bumblebee that feeds off of flowers to give us something that is just as sweet as sugar but doesn't elevate your A1C. Then I tell you, okay, you're hypertensive. We've been managing that. You come in there with 10 bottles of meds, but about 3 of them are the same. Why? And so I teach you things like, okay, let's do this, this, and this, and then I want you to go buy some beet juice. Beet juice. Yes, I need you to buy beet juice because beet juice has a normal dilation of your vessels to help bring your blood pressure down. So I start taking some of that blood pressure medicine, telling you to, okay, I know you may not eat beets, but let's start with a shot glass. And then we just kind of build, and I say, Take that one blood pressure medication, take it with some beet juice, 30 minutes later, check it and send me a picture. They're amazed. And so those are the simple things that we do there. And that I know what a pack of chicken wings costs, thighs. I do know what they cost. And so I'm not going to be out there telling you to go out there and buy a $32 piece of meat when you have 5 or 6 people to feed. So I start teaching you how to cook those things and how to use alternatives that's affordable. And so.
Wow, beet juice. You all heard that. Yes.
And
Beet juice. And I guess that's why when we were growing up, we ate beets at least once or twice a week.
Correct.
Wow, and we've gotten away from a lot of the basics there.
We have.
Things that we ought to be eating.
Yes.
So the
Yes.
beets, the beet juice.
Yes.
So you'll have me at the store soon getting some beet juice, Doc.
I want you to do things like that. People who struggle with sleep habits, okay? We look at that because CDC, if you guys are watching television and they're talking about these controlled substances in relation to people who suffer with anxiety or sleep, I tell you, you pass the tea aisle and you see things like chamomile tea or a little sleepy time tea. I tell you to go make you some nice honey. Get you some raw honey, put your lemon, drink your little tea. Before you know it, you're asleep. Cost you nothing. We don't have to worry about you becoming to the point that if you start a sleep aid, you may have to continue with that. So I try simple things with patients that doesn't affect their lifestyle. I talk about those who struggle with things like anxiety, workplace stress. It exists. Things like journaling. And so that you're just simple writing, and because that's when you're going to express more than you would verbally, and you're just going to keep writing. But the key to that is not going back to read it. You're just writing, because as you do that, you're not closing those chapters. You're just writing and you're closing chapters. It works. It does. It really does work. Then I look at things, and you hear a lot of talk about this too, autism. Why is it that has become a true issue? How many OBGYNs sit down with African American females or those who live in indigent areas and say, hey, look, I need you to take that folate acid. Folate. I need you to take that, and tell you why I need you to take that. Why do I want you to take that low-dose aspirin? Just don't walk in there and say, hey, take it. You just told me to take it. Why am I taking it? I don't take pills. But if you explain why, this is to protect your baby's brain and to not worry about things like autism or the ability to not talk or speak. We win. We really do win. It's not every visit is a 5-minute visit and you're gone. It's about taking just 5 minutes. You would be shocked at the things that patients just don't know. But it takes a little time, just a little time. It's not about the money. It's about patients winning. It's about keeping patients out of emergency rooms and keeping nurses and doctors in those areas from being overwhelmed, or urgent cares that are overworked and filled with providers and nurses that are exhausted. You're seeing patient after patient after patient after patient. And then the reason that a lot of people use those areas is because they don't trust. They don't have any trust in the person that you've been assigned to or you go and see. You will hear them say, oh, they're in for 2 minutes and they're gone. They give me this list of meds to take. I don't even know why I'm taking them. Or you're having these side effects. but you can't get in to see him for another another 10 days or another 2 months. I mean, it's scary.
It is, very much so. And so what you've sat here and talked about is true patient care.
Yes.
True patient care, and that, causes longevity. And then when we talk about knowledge being powerful and all of that, and we all want to live not just a long life, but a good long life. Live it, living the life like it's golden, as the song says. And so that is of utmost. And so I appreciate all of this information. I'm so grateful that you are here at the Leo S. Butler Center serving the people, and that's called wraparound services as well, what you give. And just grateful for all of that. And I know that you have some that come with those that are on SSI and SSDI. So give us a little quick whatever on SSI. Talk to me about the difference.
Yes. So there's a difference when we talk about Medicare and Medicare disability, okay? And so there are two forms of that. You have SSI, where SSI is not attached to the actual insurance piece, that you're clinically diagnosed with an ailment that prevents you from employment. Now, that doesn't mean that you're on it for life, okay? You may go to work, hurt your back, or break a leg, or have a bad car accident that will prevent you from working. And so you'll go into the hospital, you'll get treatment, and you may get some Medicare or Medicaid, and the services require lengthy stays, which means hospitalization, physical therapy, which means rehab, or maybe an assisted living until you're able to get back to your home or get to the baseline. And so you are approved for that through Social Security. And so they will give you some compensation for that. But you'll still need to apply for things like Medicaid, because that's what the federal government says. But then say you have a bad stroke, regardless to what your age is. And so you will not be able to perform any type of work duties, okay? And so that comes not only attached to compensation, but it also attaches you to insurance coverage. Now, how do you get that? They look at several years of employment, okay? And they call those work credits, okay? So you have to have a certain amount of work credits in order to get Social Security disability, whereas you don't have to have those work credits for what we call SSI. So that's the difference in the two. SSI, you don't have to have work credits, but for that Social Security disability, you do. Okay. And so if you're working at McDonald's, or you're working at Burger King, something happens to you, you're unable to go back there, and you have those certain amount of work credits, you do qualify for that. And so that's where I help you with that. You come in and you're struggling. We see that you're indigent, you don't have that insurance. Those are options that I do help you with getting coverage with, and also Medicaid.
Yes. And Doc, I have to say, this has been great information, and you just get ready, because you're going to have to come back to share some more information, because I believe that when people are told things, given information on a level that they understand, that they appreciate it more and willing to do it, as opposed to just settling for dropping that pill in their mouth and going on. And then when you look at all the pills with all the side effects, you think you're helping this way and you're ruining something else. So you must return. And I want you to know I'm going to get my beet juice. Yes. Definitely going to get my beet juice. And so you all have heard from Doc today. Dr. Sharolyn is right here at the Leo S. Butler Center. Dr. Sharolyn Vincent Arrington. I always like to give that real name, Vincent, the Vincent family there. And so remember this, Doc. Tell them your website and your numbers, all of your good information. I know it's there on the screen, but give them some information how they can connect with you.
So if you want to call the clinic, you can call there. Someone will answer. The telephone number is 225-256-3856. The website is https First Health and Wellness Family Clinic.com. There on that website, you can connect with our office with just a click of a button. You can leave a message, you can make an appointment, and it directly comes to my phone. I, in turn, respond immediately to you to let you know that I've seen it and thanking you for the opportunity to visit the website or call the office. We're open Monday through Thursday from 8 to 5, and on Fridays we are there from 8 to 1. But no one is ever turned away from the clinic. So whether you have insurance or not, you'll be seen and provided with what you need in order to do well.
And so, listeners, you have definitely been educated and empowered, and that's the purpose of the Coleman Cares podcast. And so, as we sign off, but we'll definitely return to you, I say that you can remember that you can always count on Coleman.
Count on Coleman. Count on Coleman. If your world is looking strange, you can count on Coleman for change.